Welcome to the 21 IWBNC. My name is Esteban Ramírez-Ferrer. I'm a second-year neurosurgery resident. Today, I'm going to talk to you about combining the vascular and open surgical approach for ruptured scalp cirsoid aneurysm. I have no conflict of interest to disclose. Scalp cirsoid aneurysm correspond to a rare subcutaneous arteriovenous fistula that presents as a pulsating mass with a progressive growing pattern. According to the size, they can cause aesthetic or functional issues as tinnitus, headache, heart failure, and blood loss, with subsequent hypovolemic shock. SCA has an abnormal connection between feeding arteries and draining veins in the absence of a capillary bed. They rarely can be life-threatening, usually secondary to severe blood loss. Also, neurological complications are rare. Up to 2019, only 3 cases were described, which include seizures, mental retardation, and focal neurological deficit. To date, there are no guidelines for the diagnosis and treatment of these lesions. We performed a retrospective review of the cerebrovascular registry at an academic institution in Colombia. We sought for patients with ruptured SCAs treated through endovascular embolization and open surgical resection between November 2019 and November 2020. Information regarding their clinical presentation, diagnosis, and treatment was collected. A total of 2 SCA cases were identified. The first case was an 18-year-old woman who presented to the emergency room because of profuse bleeding through her left eyelid. The second case was a 47-year-old female with bleeding through a right parietal scalp mass as you can see in this slide. Both patients required fluid reanimation and blood transfusion due to hypovolemic shock. Once the patients were stable, further studies, including brain MRI and digital subtraction angiography, revealed Yokouchi type C SCAs. In the first case, the arterial supply was mainly from the left median, ophthalmic, and external carotid arteries, and the venous drainage occurred through an engorged ectatic vein. In the second case, the arterial supply was from the right vertebral and postauricular arteries, as you can see in the slide. Also, from the bilateral superficial temporal and occipital arteries, as you can see in this photo. Venous drainage was through several large and ectatic veins. In both cases, endovascular embolization was followed by open surgical resection of the lesion. Complete obliteration and resection was achieved. Both patients presented an unremarkable recovery, and at 3 months follow-up, no symptoms or recurring fistula were documented. SCAs are a rare vascular malformation that should be addressed with endovascular embolization and careful surgical planning. Yokouchi type C SCAs can be successfully treated with endovascular embolization plus open surgical resection. Thank you very much.